In 2006, when then Prime Minister of Japan, Junichiro Koizumi, visited Ghana, the name of a certain man came to his mind. Dr. Hideyo Noguchi. Hideyo Noguchi, who was working at Rockefeller Institute, was the first Japanese medical doctor to gain recognition in the land of Africa. He went to Accra, Ghana, to study yellow fever, and unfortunately lost his life to this disease within several months. The year was 1928, and he was only 51 years old. With advanced public health and medical science, we now enjoy better health. However, epidemics of many infectious diseases still exist in Africa and elsewhere around the world. Now, more than ever, is the time that we must inherit Noguchi's will, thought Koizumi, and thus he established an award for a medical scientist and for a leader in healthcare systems who greatly helped African people. This is the Hideyo Noguchi Africa Prize, and the award is comparable to the Nobel Prize.
本当に嬉しいことで、日本がこういうことをするのかということで、さらに評価が高くなっているのは間違いないですね。日本がそんなことしてくれたのっていうことで、ものすごく喜んでいるということが、会う人ごとに言われるので、もう本当に嬉しいことだと思いますね。受賞した人方々の喜びの声がね、やはり周りに広がっていくことこそがね、そういう人たちがやはり日本のことをパートナーだと思っていることがすごく嬉しいなと思います。これはもうぜひ続けてほしいし、こういう形のものをね、やはりこれからも小さくてもやっていくことがすごく大事じゃないかなと思います。
実は今現在もアフリカでもう2億人3億人かかるような病気っていうのは普通にありますし、先進国では感染症がなくなったように見えるけども、実はアフリカではまだまだ多くの人たちが治療すれば治る、予防すれば感染しない、そういった病気っていうのがまだまだあるんですね。その健康ヘルス医学っていうものに焦点を当て、でまたその研究開発と実際の医療活動をしている2つの面で、きちんと素晴らしい方に賞を与えるっていうのは、これは素晴らしい特別な賞だと思います。
The award ceremonies have been held on the occasion of TICAD, the Tokyo International Conference on African Development. Here we introduce the recipients of the 5th Hideyo Noguchi Africa Prize. DNDi, Drugs for Neglected Diseases Initiative. Since its foundation 22 years ago, DNDi has been working with partners worldwide to develop safe, effective, and affordable treatments for people affected by neglected diseases that are often fatal, such as sleeping sickness. These efforts have had a broad impact on improving global health, particularly in low and middle-income countries. DNDi has also played a key role in successfully conducting clinical research in remote settings in accordance with international quality standards. For example, through the Human African Trypanosomiasis Sleeping Sickness Platform, a network of research institutes and health experts from endemic countries in Africa.
This prize is shining a light of millions of vulnerable patients and communities around the world. In a world where global health is less and less supported at the international level, we see this prize as a strong commitment and strong support from the Japanese government all around the world. More specifically, in continents like Africa, where we see neglected tropical diseases having a big burden for communities, we have done great achievements. A very good example is sleeping sickness all around the African continent. We are working in other neglected diseases like visceral leishmaniasis. Many other diseases deserve our attention, but the most important is to bring the best science for the most neglected patients.
Dr. Abdoulaye Djimdé. As a prominent malaria researcher with over 30 years of experience, Dr. Djimdé has played a vital role in improving treatment and control of malaria and made an important impact on the health policies of African governments and the WHO. The tragic childhood experience of losing a brother to malaria motivated Dr. Djimdé to pursue research on malaria, an endemic disease threatening many lives in Africa. He continues to dedicate himself to realizing the dream of a malaria-free Africa.
On the clinical development side, I'm working on novel classes of antimalarial drugs. Currently, the main drug is artemisinin, and there are cases of partial resistance in East Africa and in the Horn of Africa. So we need to be prepared and to find a new class of drugs that would work should the parasite become resistant to artemisinins. That is really information that there is no more reward than hearing villagers say that since you started working in the village, children are not dying anymore. That's the kind of moment that keep us going. So my intention is to I'm already planning on ways to invest this funds to bring more opportunity to more young scientists to be trained in basic science, so that one day, in addition to testing drugs that are invented by others, our young people can invent new drugs and new vaccines to fight diseases in Africa.
Now we introduce the recipients of the 1st to 4th Hideyo Noguchi Africa Prize. Professor Miriam Were. For over 40 years, Professor Were has dedicated her life to the improvement of health and welfare of the African people, especially women and children, and for provision of primary health care in the community.
Currently the Chancellor of Moi University. Since receiving the prize, I have been invited to many other bodies. I am a member of the Champions for AIDS-Free Generation in Africa. My focus has been on community health. We must focus more on promotion of health, like nutrition, as well as preventing disease, such as through immunization and through hygiene. And this is one way that Africa can control how much money is spent in the health sector. So I would like to encourage young medical researchers and young medical service specialists to really be committed on health prevention, health promotion, as well as being good clinicians to provide good services to our people. Hospitals don't change health, they treat disease. Thank you very much and best wishes.
Professor Sir Brian Greenwood. For over 30 years, Professor Greenwood has worked based in Africa on research and practical measures against malaria and other infectious diseases.
So I'm very honored to be one of the 2 first recipients of the Hideyo Noguchi Prize, and I'm very grateful to the government and people of Japan for establishing this prestigious award. I considered how best one could use the considerable sum of money that comes, prize money that comes with this award. I thought that the best thing to do would be to establish a scholarship program for young African scientists that would allow them to undertake a master's degree. During the past 5 years, over 4,000 applications have been received, and it's been possible to make 30 scholarship awards.
Professor Alex G. Coutinho. Professor Coutinho is a pioneer for increased access to treatment for HIV-positive people in Africa, where 70% of the world's HIV-positive patients live.
I received this prize in recognition of the work that I and many others had done in scaling up HIV services. Since I received that prize, I have now applied the knowledge that I have accumulated over 35 years as a doctor in scaling up medical services to new challenges. It's important that prizes like the Hideyo Noguchi Africa Prize are supported and encouraged, because it will encourage the younger generation of Africans who are coming up in the field of research and medical service delivery to aspire to one day also be recipients of this prize.
Professor Peter Piot. Professor Piot's career in Africa began with his discovery of the Ebola hemorrhagic fever some 40 years ago, and his work has been instrumental in raising HIV and AIDS as a major global issue.
Receiving the Hideyo Noguchi Africa Prize was definitely one of the highlights of my career. In the first place, because Dr. Noguchi is a truly universal role model for all of us in global health. And I trust that the prize now will attract the best of Africa's researchers so that their work can receive all the support that is needed.
Dr. Francis Gervase Omaswa. For his great contributions to addressing the global health workforce crisis, including education, training, retention, and migration of healthcare workers, and building people-centered health and medical systems, not only in Africa, but also worldwide.
Since the award, I have continued to work at the African Center for Global Health and Social Transformation, focusing on strengthening health systems in Africa, community health services in particular, and also on strengthening human resources capacities in African countries and creating movements here in Africa which support health workforce. Part of the money and the substantial amount has gone towards building, constructing an institution which is named in memory of our daughter who died in her early 30s some years ago. It is called the Frida Omaswa Health and Community Institute. It is intended to support strengthening of health systems and educating and training new generation of health workers who will contribute to strengthening health services, not only in that area, but also in the whole of Uganda and Africa.
Dr. Jean-Jacques Muyembe-Tamfum. For his great contributions in the fight against Ebola and other viruses, both through his own research and in training healthcare workers.
So the Hideyo Noguchi Prize remains a great symbol of the visibility of African research. And this visibility is a stimulus for future generations of young scientists. The most important areas of my research is Ebola, and also the second field of activities was Mpox. Mpox was a neglected disease in DRC. It was an endemic disease in DRC that was neglected. But since the outbreak of 2022, the multi-country outbreak, Mpox was declared by WHO as a public health emergency of international concern. So we conduct pioneering activities on this virus that is now public health emergency of international concern.
The Guinea Worm Eradication Program. For the near eradication of Guinea worm disease, led by the Carter Center and carried out with partners such as governmental, non-governmental, and international organizations.
I think it would be an understatement to say that the Hideyo Noguchi Prize awarded to the Guinea Worm Eradication Program and the Carter Center has been a phenomenal change maker in helping push the effort to eradicate guinea worm disease globally forward. The success of the global program to eradicate guinea worm in part makes it difficult to finish the job because we went from 3.5 million people each year with guinea worm to only 13 people at the end of 2024. So now you are really looking for a needle in the haystack as you try to make sure that this disease cannot come back and attack people. And so it's thanks to the Hideyo Noguchi Prize and the people of Japan that we were able to push that forward.
Dr. Salim S. Abdool Karim and Dr. Quarraisha Abdool Karim for their great contributions to worldwide HIV and AIDS prevention and treatment, training African researchers, and controlling the spread of COVID-19 in Africa.
It's a great way to affirm and acknowledge his contributions, but also that this prize is focused in Africa where it made significant contributions, and to recognize African science and excellence is deeply valued in Africa, showing the role African science is playing not only in addressing challenges in Africa but also globally.
In addition to continuing our research on HIV, we now play an important role in supporting a range of different initiatives, and one specifically right now is on the Mpox situation in Africa. We are involved in Mpox research and supporting the Africa CDC in their efforts to respond to this problem before it becomes a major global challenge. The Hideyo Noguchi Prize has played an important role in our research. It has funded our research on broadly neutralizing antibodies, a way in which we are developing a new technology to prevent HIV, and it has funded several students who are now doing higher degrees and developing themselves as researchers in Africa.
Japan will continue to promote the Hideyo Noguchi Africa Prize and to call for international cooperation for improvement of the health and welfare of Africa, whilst continuing to take a leadership role in the field of global health for this important global cause.